Hey everybody, what's up? I'm DJ Sixsmith. You're watching The Sit Down. True life, first time, first responders. We're talking with Nurse Barbie today. How are you?
Hey guys, how y'all doing?
It's great to talk to you. I'm sure it's been a really crazy couple of months for you. Obviously, COVID-19 has just obliterated the world, and especially New York City, especially the Bronx. So what have the last 3 months been like for you?
The last 3 months have been so hectic, but yet so exciting. It's taught me a lot about myself as a person, as a colleague, as a nurse, and definitely as a daughter and a family member. COVID-19 is awakening a lot of things, a lot of fear in people. People are pushed to the limit. They're tested and it's definitely showing.
So when did COVID-19 really first come into your life in terms of like, okay, this is going to be something I'm going to be dealing with for, several months on end?
So when we finally realized in the hospital setting that COVID-19 was going to be around for a while was maybe in March. A lot was still unknown about the virus. There's still a lot unknown about the virus. There's no vaccine currently. Research is being updated day in and day out. And I think it was around March where we saw like, oh my goodness, this is something that is going to be around for a long time, and it's definitely changed the world to come. Wearing masks is going to definitely be something that's sticking around for a long time. They say public events won't even happen until 2021, the fall of 2021. If that's not crazy, I don't know what is.
Yeah, I mean, this is life-changing in so many different ways, and you're used to seeing crazy stuff in the hospital and when you go on calls, but yeah, I mean, all the time, but this must have been different for you. So what were some of the symptoms that you saw? Because some people, they could barely breathe. They had these really bad coughs. They had to go on ventilators. What were the first little signs you're like, I've never seen anything like this with people before?
So I'll just share a little story with you. I had a patient that came in and, she's like, I've been having a cough, fevers on and off, a little abdominal pain, a little diarrhea, which are signs that now we see are more prevalent with this disease. People didn't even realize that abdominal pain, diarrhea, nausea are also now associated with COVID-19. And her oxygen saturation, which is the detection of oxygen in your blood, was 60%. Wow. Now, normal oxygen saturation is, for a normally healthy person without any respiratory diseases, would be 94 to 100%, roughly 95 to 100%. 60%, this lady was. And I'm like, are you okay? And she's like, I feel fine. I'm talking. I'm talking to you. I feel short of breath, but I'm able to talk. There were a lot of people that was like that. And then there were also people, 80% oxygen, who just could not breathe. They look at you and you see the distress in their faces. So there were different types of population with COVID-19. I think those two are probably the most popular, in a sense, ones where they're managing with the disease and you cannot believe it. And then you have even young people without any past medical history, where we once believed, oh, it's okay. If you're old and you have a lot of things going on with your health, you'll probably be affected, but no. Now we see that it affects all types of people, whether they have a medical history or not.
How scared were you that you were going to get the virus?
Oh my goodness, I was deathly afraid. We did not have enough personal protective equipment, what's now known commonly as PPE. We did not have enough in the hospital system or even volunteering as EMS. We've seen people just expressing how afraid they are to take care of other patients, knowing like, hey, I have a family at home. And it definitely hit home to me. My parents contracted the virus. Oh, wow. And I knew I had to take care of them. So that made me even more determined, in a sense, to not contract them myself. Because I live not only for my family, but for my patients and all those around me. I have a duty to protect and definitely help them as well.
How bad did it get for your parents, if you don't mind sharing?
I don't mind sharing. It's honestly a blessing. God is great. my mom shared with me after the fact. I did help them get better, glad to say. And my mom shared with me after the fact that she thought she was on her deathbed.
Wow.
She didn't want to scare anyone, you know, but I was able to have, which I employ everyone to have, portable blood pressure machines, portable oxygen saturation monitors, thermometers to check your temperature, because these things help show what stage you're on. My parents were very sick, very, very sick. Their oxygen got as low as to 80%. And yeah, I nursed them back to health. They're now working. My mom is also a nurse. Wow. And she wanted to be able to go back to work and help others because I helped her, you know? So now they're doing great. They're doing awesome. They're both back at work. They're healthy. And they're also sharing their stories. That's
awesome to hear. And I think people are really going to get awesome perspective on this, because we've all heard the stories about people being sick, people being in the hospitals. Yes. A lot of people haven't seen it. So when people do check it out on Tuesday, what are some things you want them to focus on in terms of what they're seeing when you go on a call, what they see in the hospital, and how you guys dealt with patients?
I want them to focus on how hard we worked to save each and every life. With equipment, without equipment, we made do with what we have. I want them to focus on how we felt, the energy that we brought to each and every home, volunteering with Throggs Volunteer Ambulance Corp. Such a great opportunity, and it'll definitely show the people just a glimpse of what EMS professionals and nurses go through, even coming into your home to save you. Not just you going to the hospital, but us coming to you.
Nurse Barbie, you've sacrificed so much these last couple of months. What's most important for people going forward in terms of taking the virus seriously? Like you said, wearing masks, like what should we focus on in terms of just getting our lives back to somewhat of a normal situation?
So I do share a lot of educational material and information on my Instagram, __Nurse Barbie, and my Facebook page. I want people to start taking preventative measures, start eating healthier, getting more active. And I know these things sound cliche, but building up your body to have a better immune system will always combat any disease that comes your way. People need to wear protective face coverings, whatever they have, but now masks are being given out to the public, which I think is a great thing. And just looking at the symptoms. Are you short of breath? Do you feel like you have a fever? Do you have abdominal pain? Are you having diarrhea out of nowhere? These are the things that you need to watch for with not only yourself, but your family members, your friends around you. And if you think you're sick, you need to quarantine. Call your doctor. There's a lot of telemedicine, telehealth that's going on. You can call in. Now they can FaceTime you. They can see you face to face. And they'll let you know if they feel like you should definitely go to an urgent care or ER to seek more medical attention.
Nurse Barbie, thanks so much for sharing your story. Looking forward to having everybody check it out. Tuesday night on MTV. We'll talk to you down the road, all right? Be well. Thanks so much.
Thank you so much. Bye, guys.